The sooner you can get better and get safe to go home, the better it is for you. And again, it all comes down to mobility and decreased chance of infection. The mobility is the most important thing. You know, generally when you go home, we want you to get up and move at least once an hour. Get up and take a walk at least once an hour when you're awake. And you just can't do that in the hospital. And we will make sure that you feel comfortable before you go home. That's part of the goal. Not only to be able to do everything, but to make sure that you feel comfortable and safe for when you go home. So we work together. It just so happens that, hey, you meet a lot of those goals quickly. And I think that's the biggest shock to people is that, wow, it's a day after my surgery and look how well I'm doing. And wow, I actually am safe to go home. There are some things that you can do to prepare your house before coming in for your surgery. One, make sure that all the clutter is out of the way. Remember, you're going to be using a crutches or a walker, so you want to make sure your walkways are clear. Make sure that all wires are out of the way from lights and things like that. Make sure you have good lighting, especially if you have to get up in the middle of the night to go to the bathroom. Pets, if you have any pets, make sure that you're not running over them or they're running over you. Also, throw rugs. Get rid of any throw rugs you have. They're a fall hazard. Other things, food preparation. Make up some meals for yourself that are easy just to take out of the freezer, throw in the microwave. And the biggest thing that you can do, now's the time to cash in all your favors. Call your friends, call your family, call your neighbors. Anybody that's able to come and give you even a little bit of help when, let's say, your husband or your wife or the person you live with, if they're at work and you're alone or you live by yourself, make arrangements to come and help you with some of the things like making meals and things like that. Most patients are going to go home. At least 80% of our people go straight home from the hospital. And as I talked about, anytime after the first session on post-op day 1, you could be safe to go home. That's how quick you're able to get up and move around with whatever help that your companion or caregiver can give you at home. Now this is where it'll be important if you live alone to make sure that you have made arrangements before you come into the hospital, because rehab is not promised. Rehab is only needed if it's needed. So for example, if you live alone and we see you and you're able to do everything by yourself, you're safe to go home. So it's a good idea, as we talked about before, call your friends, family, neighbors, whoever, and try to arrange some people to be with you if you feel like that's potentially going to be an issue for you, or hey, make arrangements to stay with somebody in the beginning. Yes, patient can have home health. Our case manager would set that up. Generally, you'd have the therapist come to the house for about 2 weeks, and then you'd start outpatient therapy. If you're able to do it, generally we recommend you start outpatient right away, but if you don't have a ride, if you live alone, then you may need some inpatient, some in-home therapy in the beginning before you go to outpatient. As far as what is covered by insurance, the case manager will be able to answer that for you. When you leave the hospital, we give you a home program to do, and then the home program is merely to bridge the gap between when you go home and when you start your next round of therapy, whether that's therapy in the house or outpatient therapy. At that point, you're going to do what they tell you to do. Definitely make sure that you've arranged for people to take you to therapy, because outpatient therapy is something that you're going to want to have after your surgery. When you're making your appointment for outpatient therapy, try to time it with when you'll be leaving the hospital. And remember, generally you'll be leaving the hospital only a day or two after your surgery. So if you have for example, if you have your surgery on a Monday, hey, schedule for Friday to start your outpatient therapy, because chances are you'll be going home Tuesday or Wednesday. We give you exercises to do to bridge the gap between when you go home and when you start your outpatient therapy.
As the orthopedic program coordinator for the past 13 years, I have great pride in our team, in our patient population, our outcomes, everything that's associated with this program. This has been evidenced by many of the certifications and awards that we've received. In particular, the Joint Commission Disease-Specific Certification. And this is a survey where we have an on-site surveyor in orthopedics come in, view the processes, view a surgery, talk to patients, and see how we stack up against many across the country. We've had a stellar rating for the past 3 surveys with no findings. That's almost unheard of. We also have a 5-star rating with health grades in our quality and outcomes in total knees and total hips. And we also have Blue Cross Blue Shield's Blue Centers of Distinction for excellence in total knee and total hips. So all of those make us very proud.